As students in many health professions, some of us students and current health professionals in various fields, we have come together and hope to continue advocating for healthier communities and just health service. We have taken the first step of consciousness today, understanding the invaluable role of health policy, although keeping in mind the complexities associated with navigating a healthcare system. The panel here today represents an interprofessional panel of health advocates and leaders from various stages within a health service career. As students and professionals, we strive to become more involved and active in health policy. And for many of us, searching both inside and outside for what this entails. Today, we hope to learn from the panelists as they answer questions created by ATSU students on how to not only ignite a fire, but keep a flame of involvement in health policy. Without further ado, I would like to introduce the person in front of me who is moderating this event, Stanton Jasicki. Thanks again, I hope everyone enjoys the event today.
All right, thank you, Daniel. Yes. My name is Stanton Jasicki, and I'll be moderating today's event. All the panelists have been briefed on the format, so let's get started with the first question. Each panelist will have 3 minutes to answer the first question. Ms. Chen, let's start with you. Please introduce yourself and explain your current role in health policy.
Hello everyone, it's a great pleasure to be here. My name is Chen, and I'm a 4th year medical student at SOMA. I'm currently taking a year to complete an osteopathic teaching fellowship on campus, so I'm currently living in the area. So the question, my current role in health policy. I feel like my current role in health policy is twofold. You know, I'm a student in that, and I'm also a liaison in the role. So what do I mean by that? So as a student, not only do I feel like health policy is a really big word. You know, when I first came to medical school, I felt this inherent, you know, social obligation to get involved in health policy, but I really didn't know how to because there's so much to it. You know, you have the provider side, you have the patient side, you have the providers in training that also have health policy issues involved. And so right now, as a student, I spend a lot of my time reading about this, you know, talking to people, attending events and conferences where I can learn more about the issues that are relevant right now and how the current state of healthcare as it is today has evolved to what it is, to be what it is. To kind of provide an example, I spent the last 2 years in Brooklyn completing my clinical training, and something that I found really interesting was while I was in the clinic, a lot of kids came in on my pediatric rotation, for example, with obesity. And it was this huge issue, and you know, there was the counseling side that I did on the provider side. But you know, as I was living in that community, I saw the access issues. I saw the access issues for food. I saw how the barriers that existed for these people to have access to, you know, there was more to the problem. There's a lot of systemic issues that had led to the situation that was at hand. And so then in learning about that kind of motivated me to maybe look at, well, how can I help from a public health perspective, from a policy perspective to address this issue so that we can prevent, you know, this problem from occurring. And so right now, learning and reading a lot about that is a big part of my role. And as I learn, I serve as a liaison to my fellow students. You know, throughout my 3 years so far, I've been a part of the Student Osteopathic Medical Association, which I Daniel and Stanton now, and organizing events like these where we can talk about what health policy is, how to get involved, what are some of the issues. That is something that I see as my role, and I see as continuing to be a part of my role in health policy.
Thank you for your response, Ms. Chen. Senator Ward, please introduce yourself and explain your current role in health policy.
All right, thank you all so much for having me. My name is Kelly Ward, and I am an osteopathic family physician. I am also currently serving in the Arizona State Senate, which means that I only go to Phoenix. I don't go to Washington, D.C. very often, every now and then, but not every day. I represent the district, it's called Legislative District 5, which is most of Mojave County and all of La Paz County, so more of rural Arizona. At this point, I'm the only female DO serving in state or higher elected office, so I feel like I can have a strong voice and make a big difference there. I'm right in the trenches, making health policy every single day, looking for input from people like you, students, professors, people in academia, people in the trenches taking care of the patients that we all want to serve. I did a master's in public health, I believe in 2003, 2004 is when I finally completed that. Through AT Still, School of Health Sciences, so I've got a connection here on campus with you all. I've been involved in student politics, osteopathic politics, medical politics, really from the time I started in osteopathic school in West Virginia. I was a proud member of the Student Osteopathic Medical Association, working my way up through the ranks to become the national president of that organization. And just as a side note, I wouldn't have met my wonderful osteopathic physician husband, Mike Ward, if it weren't for SOMA. He went to Kirksville and I went to West Virginia, so we were those SOMA love people. And and I think the most important thing I want you all to know is what an important voice all of you can be for us at the legislature and at the national level as well. Because there are very few medical people serving in elected office, and many of the things that affect us in our professions every single day, those decisions are being made by people who don't have experience and don't have expertise, and it affects the way that we are able to provide access to high quality, cost-effective health care to our patients. So please connect with the people that represent you and become a resource for them so that there are common sense approaches to what we need to do to take better care of our patients. Thanks so much. I look forward to talking to you all throughout the day.
Anyway, my name's Joe Abate. I'm an attorney here in Phoenix, and I've been practicing law for about over 40 years now here in the state. My practice is totally now lobbying at the state legislative level, mostly. I represent, I started out as majority counsel in the House of Representatives in the mid-70s, back in the middle ages, and I've been into lobbying, and I've been doing that ever since. I represent a variety of different clients at the legislature, but mostly healthcare, including the Arizona Osteopathic Medical Association. I've been representing them since January 1985, I'm proud to say. And they're a great group, and we'll get into ways of you getting involved in the process of you who are getting your medical degrees and maybe practicing here in the state, hopefully. That's a good avenue of involvement, which we'll talk about later. I'm also Arizona Council for Pharmaceutical Research and Manufacturing of America Pharma. So I'm involved in a lot of those issues, and plus a variety of other different clients, psychiatrists, podiatrists. I love to say that I'm covered from head to toe, so I cover all bases, right? But, so anyway, I do spend a lot of time at the legislature, went down there during the session, and interact with public officials like Senator Ward. And my job as a lobbyist is to represent your client's interests, obviously, at the legislature, to interact with the legislators, to give your client's point of view, to make amendments to bills that are better for your client's interest, to oppose legislation that are detrimental to your client, and obviously to support legislation that is beneficial to your client and hopefully to the public as well. We all like to couch our representation as fighting for truth, justice, the American way, but sometimes the focus is more narrow than that, unfortunately. But that is the role that I play as a lobbyist in our political system.
Thank you, Mr. Abate. Dean Dillenberg.
All right. Hi. And this young man I've known for over 25 years in my former lives.
We haven't changed it.
We haven't changed it yet. No. Really, it's scary. Anyway, for those of you that I haven't had the pleasure, privilege of meeting, I'm Jack Dillenberg. I'm a recovering dentist. I've had the privilege of being the inaugural dean of ASDO here in Mesa. In my former life, getting into policy, it sort of started really early on. We were in NYU together at the same time. He was in the law school, I was in the dental school. I got class president for 4 years and president of all at NYU my last year. as a student, which was a big deal and got me down to the White House to meet President Nixon as an advisor on campus unrest after the tragedy at Kent State, and started to meet some of the folks and thought that, gee whiz, having a conversation with people can influence them. So I think, as the senator had mentioned, and Joe mentioned, getting involved in having conversations with these folks is critically important. I wound up working with special needs folks. I was a dentist at an institution for the severe and profoundly intellectually developmentally disabled in rural Connecticut for a couple of years, and that changed my life, recognizing that people with these types of disabilities are critically underserved, in great need, and need you and I as healthcare providers to be champions for them. And that was something that changed my life and made me an advocate for those with special healthcare needs early on. To get away a little bit, I wanted to chill, so I moved to the island of Jamaica, where for the agriculture, I loved the coffee. It was not the rum. Thank you, Joe, for clarifying that. You know, I ran a dental clinic in a fishing village there for a number of years, lived in a thatch house on a beach, and got to understand poverty, and got to understand the needs of rural poor people and their access to health care. And that really changed me, and I knew I wanted to do more. And this is where we start to think, what is this policy about? What do you want to do? I realized I wanted to get out of rowing the boat to steering the boat. So I went to Harvard and got my master's in public health, joined the faculty at Harvard for a number of years, and started to influence things from that perspective and educate young professionals at Harvard in public health and dentistry. And that turned out pretty good, and wound up coming to Arizona, got in government, became the state dental director, where I really got to drive public health, oral health policy in those days, start fluoridating the city of Phoenix. That was a big deal. Back then, working with Terry Goddard and the city, trying to get that done, and learning the ins and outs of how do you get policy done, how do you get laws passed, what are the do's and don'ts. And it was really quite an exciting time for me. We started Dillenberg, working with the legislature and things. It was really fun. I got ultimately to become the director of the state health department here in Arizona, which was quite a thing for a dentist. At that time, only being the second dentist in the history of the United States to run a state health department. And so I was in the governor's cabinet for 4.5 years, and it was pretty cool, except for the Senate confirmation hearing. Don't ever worry about an IRS audit if you have to do a Senate confirmation hearing. And that was quite something, as you remember, Sue Gerard and those folks. That was, I was 6'3" and had a full head of hair when I walked in. I was singing an octave higher and was bald and 5'6" when I came out. But nonetheless, I got to influence policy at the highest level, and that was really neat. And I think that's really important. If you believe in things, if you are honest with yourselves, and I think those are some critical qualities that you have to have as a meaningful healthcare provider and as a meaningful leader. Let me know, am I done? I got another 10 seconds.
There you go, yeah.
Nonetheless, so I've had the opportunity to get engaged in policy. It's been a lot of fun, and now doing it on I'm on the boards of a number of not-for-profit organizations throughout the country and have a chance to influence at that level, and we'll talk about that at the right time. But thank you, it's a treat to be with you.
Thank you, Dillenberg. The second question is, when did you become involved in health policy, and what were some of your motivating factors? Each panelist will have 4 minutes to answer. Senator Ward, let's start with you.
As I kind of mentioned before, I was interested in osteopathic medical and medical politics from the beginning. And I've always kind of been a person who's been involved with what's going on. I mean, from the time I was in elementary school, when you could first be on student council, that was always something that was important to me. I didn't want to be a person who just sat back and waited for something to happen. I wanted to be one of the people that was making something happen. Because the people who sit back and just wait often are the ones who just complain and say, what the heck just happened? And so being aware of what's going on is very, very important. So that health, when I got accepted to osteopathic school in West Virginia, it became apparent that you needed to be involved. And we have a saying also in politics that if you're not at the table, you're on the table. So you always want to be at the table, not the one being served up. And so that got me involved professionally. When I came to Arizona, one of the very first things I did was join the Arizona Osteopathic Medical Association, because I knew that was a group that was going to advocate for my profession politically, both at the state level, but also at the national level. I also became involved with our universities, with both Midwestern was the only one that existed at that time, but when AT still came online, I'm a clinical or an adjunct professor at both places, so I think that's also very important to keep your finger on the pulse of what's going on in our educational system as well. The thing that turned me towards, I don't know, the bigger political picture really was September 11th. When September 11th happened, before that I really was happy-go-lucky. I would just turn on the TV and watch the Today Show and look up recipes and had this rosy view of what the world was like. But when that happened, it really woke me up. It made me, I looked at my kids who were very little at that time, and I thought their world that they're going to grow up in is completely different than the world I was so blessed to be able to grow up in. And what has happened, or what's happening at the national level, at the state level, and at the world level that could allow an event like that to happen and to change what's happening. So for me, I really had to start reading different things, watching different TV shows, and educating myself about policy in general, not just health policy, because I was very focused before, but policy in general. And I wasn't a public policy, a policy major in school. I was a psychology major. I wasn't even a biology major or a chemistry major. I was in the psych side of things. And so it became a learning process for me that I thought was very, very interesting. And so then I started to think about the people who represented me at the local level, at the state level, and the national level. And I started to want to interact more with them. And I started to write letters, I started to write emails, make phone calls, and a lot of times I was disappointed in what I got back, which was either nothing, which is the main part. From the national level, generally I would get back a form letter that had some minor thing to do with what I was writing in about. And at the state level, at times you'd get things back and at times you just felt ignored. And so, I threw my hands in the air and I was like, why doesn't somebody do something about this? And finally I just looked at my hands and said, why don't I do something? I've got knowledge, I've got experience, I've got a health policy background. I did a master's in public health and piggybacked that, or a health policy fellowship and piggybacked that into a master's in public health. There were things that I could do that I've always been a person that thinks I'm supposed to share what I've been blessed with, and I shouldn't be hoarding it just to my family or my patients within my private practice, or there were things that I could add to the greater good. And so it takes a lot to put yourself out there politically, because half the people aren't going to be happy with what you do. So you have to develop a very, very thick skin and know that there are going to be attacks, and keeping your principles and keeping your morals and your ethics are very, very important in that situation. So I think I'm well equipped, and I'm striving to do that, and I think it's something that anybody can do. We don't have enough health professions that are represented in the political world, so please, I talked to a few people who are interested. I'd be glad to be a mentor, but and one other thing, keep your nose clean, because things come out of your past and come back to haunt you. So keep your nose clean, and you can make a big difference in this process as well. Thanks.
Thank you, Senator Ward. Mr. Abate?
I've been involved in just public policy and politics all my life. I was involved in college. My kids, college Republicans. I rose to the ranks, became National College Republican Chairman, and traveled all over the country before I even moved out here, in trying to get involved in the process and believing in the process, and have, as Senator Ward said, you have devotion, faith, determination to change policy in some fashion. When I came out here to Arizona, took the bar, worked in the Attorney General's office, worked in the legislature, sat as majority counsel, and then went into private practice. But also, I was involved in my party of preference, the Republican Party, and I, for 16 years, was general counsel to the state party as a volunteer, and something that I was devoted to. And so I believe in the two-party system and the political process, and that could have an impact on policy. but also professionally as an attorney, being a lobbyist, I have had a great opportunity to be involved in public policy and to interact with policymakers and to try to influence, to represent on behalf of my clients what we feel is not only in the interest of my particular client, but also keeping in mind, hopefully, the public good as well. Because regardless of your client's position, if you can't convince a public policy official that it's in the public interest, and you know, in Illinois they have a saying, you know, there was a tavern owner that was in the legislature, and he got a bill passed, introduced a bill that extended the hours from 1 a.m. to 2 a.m. And the reporters came up to him, Senator, isn't that a conflict of interest? He says, hell no, it's in my interest. So, I mean, there is a perception like that in some cases, but in Arizona, I think we're very lucky compared to other states. Ethically, I think we're a notch above many other states. I really do believe that. Coming from New Jersey, originally, I could make the comparison. You notice there's no bridges that are, you know, being competed over here. So it's a lifelong endeavor for me, you know, as far as health policy. It's funny, when I went into private practice 30 years ago, most of my work was agriculture. That was the economy, that was it. I represent several different agricultural clients. One of my first healthcare clients was representing Phoenix General Hospital. When I went on my own, it was my first. That led to the Osteopathic Medical Association. That led to other healthcare clients, and it just grew. Now I don't represent any agricultural clients, and I represent several healthcare clients. It also reflects the growth of the economy, the type of economy we have in Arizona and around the country, because healthcare now is probably the biggest industry, and in Arizona has probably created the most jobs, even during the recession, than any other segment of our economy over the last few years, and it's continued to grow. Obviously, there's the need. So that's a little bit about my background and where I'm at, and it's certainly been fun for me. I've enjoyed it.
Thank you, Mr. Abate.
How you doing from New Jersey?
That's right.
Joe.
We have ways to deal with it.
That's right. When I was a kid growing up in Queens, New York, I needed a visa to get into New Jersey. You know, I look back, I'm a child of the 60s, you know, old hippie. And it was during that time, civil rights, MLK, this was a big deal. I went to college in the South, and I got to see up close and personal some of the real inequities in this country. The anti-war movement, Vietnam War was a critical issue in those days. And so it was a very exciting time, if you will, for getting engagement, getting involved. There were issues, and you had to do something. You know what I mean? You either had to move to Canada, you know, or get involved, or do something. You know what I mean? It was that kind of a thing. That was the era of that time. And, you know, it was interesting. One of the things that I've learned, you know, I was a shy, retiring, I was a type B kid, you know, and you sort of get thrust into things. One of the things that the Senator mentioned, too, was so important is the ethics. You know, I tell my students, one of my quotes, I use, the most difficult glue to find is the one to repair a broken trust. You know, credibility is so important. Yeah, you know, keep your nose clean. I mean, for me as a young guy, you know, a 60s boy, I mean, going back would be a little, you know, the good news is people are forgiving. That's where the honesty comes in.
Your stuff's not on the internet.
That's right, there it is. That's why I don't do Facebook. You want me, you can Google me, you can look at my blog, but I don't do the Facebook and I don't tweet. I learned that gets you in more trouble than the benefit of either one of those two things, I think, as I've learned over these last few years. But I think honesty is critically important. And I think the human capacity for forgiveness is critically important. And that's a good thing for all of us. You know, is to really try your best, be honest in what you do. And, you know, we do have a two-party system. What was interesting, I was in the cabinet of a pretty conservative governor. You know, when Fife, you know, and I voted for McGovern. you know, when I was a young guy. I mean, I was a pretty liberal guy, but we got along because we shared a value of improving the health of the people in Arizona. We shared a value of commitment to honesty and making a difference. And I think that's something that you need to look at. You know, I'm a big fan of Maslow, you know, hierarchy. You got to start right down here. You know, you get people secure, you get them places to sleep at night, get them food. You know, before you start getting up here for this intellectual, spiritual, and stuff. And I think we need to understand that in what we do as we develop ourselves. And for me, that was part of my getting engaged in policies. I mean, what are the fundamental things that we can do to help people? I worked in Calcutta for a number of years as a World Bank public health consultant. And I had thousands of people that shared one water spigot. And I'd come back and my dental colleagues say, well, are you doing a fluoridation program? Are you doing seal? I said, no, half the kids died before the age of 5. I got to do policies to get safe water, get rid of their waste. You know what I mean? Get safe housing. So those are the things to start to think about. And so anyway, I want to hear some of your questions. Thanks a lot.
I guess I could say that my involvement in health policy began when I was really young. My parents immigrated to the United States, and living in a new country for them was a really big struggle. And so growing up, seeing the language barriers, seeing the access to healthcare barriers, seeing a lot of their struggles going through, I was just very acutely aware of what it was like to live in a new country with a new set of rules. And I think that really propelled me to do a lot of community service throughout my high school years and throughout college. And one experience that really sticks out for me is during my last year of college, I got really involved in organizing health fairs. And, you know, we would bring all these, we would go to underserved or communities with a lot of uninsured populations, and we would screen them for blood pressure, diabetes, and if somebody had really high values, we would try to connect them to community health centers in the area. And although it was really satisfying to, like, you know, see the turnout and be able to provide these services, I never really saw the follow through. I never knew if these people actually got the care that I felt that they had deserved. And so kind of moving on from college, after that I went abroad to Ghana, and I volunteered a little bit there. And I think that was probably the first time where I saw the impact that policy could have on a community. To bring up a specific example, I was working in a maternity ward, and something that I'd never seen before was they would take mothers who had conceived around the same time, and they would clump them into clusters. And they would bring them in for prenatal care and talk about prenatal vitamins, give them education seminars, and they would have these, you know, volunteers and these nurses give these educations to this large group. And so that kind of satisfied this, like, you know, healthcare shortage or healthcare provider shortage, but it also provided the services that these mothers needed and the education they needed to provide to have a healthy pregnancy. And, you know, over the last 10 years, one of the WHO's goals has been to decrease birth rate mortality in sub-Saharan Africa, and I think campaigns like that really, and policies that allowed campaigns like that to happen, had really a big impact on the communities, you know, throughout that area. So after that, coming to medical school, I knew that I had to get involved somehow. And so joining the Student Osteopathic Medical Association, going to DO Day on the Hill every year, going to the Arizona Legislature Day, even if I didn't know the issues, like electronic medical records, or graduate medical education. Like, these were issues I wasn't really familiar with, but I knew that I had to get involved and kind of just see what was going on. I wanted to, you know, just have that experience, talking to legislators, being educated about the issues. And, you know, after going to these events for the last 3 years, I'm starting to recognize some of the terms, some of the issues that are repeating and that are continually coming up. And so this year, as I'm doing this teaching fellowship, I'm learning a lot more about graduate medical education, and I'm finding that this is where my passion and my interests are, and there's also a huge need to reshape how we're training our healthcare providers to create a sustainable workforce for the future. And so, you see, it's kind of in this process, and it's continually changing, and I'm really excited to see where this goes and how I can, you know, have an impact on the profession.
Yay.
Thank you, Ms. Chen. Each panelist will have 3 minutes to answer our final question. Where do students start if they want to be involved?
Well, I think there's certain areas, depending on how you want involvement, you can get into a variety of different ways. One is to get involved in the, let's start the political process, because to me, that's where it's all at. Campaigns, volunteering in campaigns in your spare time. The age of the volunteer, quite frankly, is dying off in a lot of ways. And candidates need volunteers to do things a lot more sometimes than even money. and believe it or not. And I think there's, to get involved with making phone calls or walking, getting petition signatures, which are vital for candidates. That's very important for candidates to get the necessary signatures to qualify to be on the ballot. Things of that sort. The campaign end as a volunteer is one way. Once you graduate and become physicians or dentists or whatever professional license you achieve, to get involved, to me this is very important, because I believe wholeheartedly in this, get involved in your trade association. You get involved in the Osteopathic Medical Association or the Dental Association, whatever. This is vital to me, to not only to protect and advocate your profession, but also you can, your trade association plays a vital role in not only protecting your profession, but also protecting the public and educating the public and public officials, not only the importance of your profession, but the issues that you deal every day in your profession that you need to educate legislators, for instance. You know, legislators are not experts in everything. They need education, and they appreciate it. And you, as a professional, are in a sense, the expert, and you can enlighten and educate someone like a public official better than anyone else. You know, I go and try to educate as a lobbyist, but they'd much rather hear from you directly about some of their problems than to listen to me. They're tired of seeing me. But you know, that is, so the importance of your involvement, I can't overemphasize that. It really is vital to your profession, to your interest, and to the public's interest. And so you can involve yourself in the legislative process too, by not only being involved in your trade association, but as an adjunct to that, writing letters, emails, phone calls, getting to know your legislator. I mean, there's so few people that know their legislator now, and as districts become larger and larger, it's even more the case. But if you know a public official, you will have that much more influence on him than someone out of the blue. I don't care, you might have the greatest credentials in the world, but that personal contact is so important. It's human nature, it's obvious when I say this to you, but that's something, again, it's a way of getting involved, to get to know your local officials, because that's so vital to the process. I'd like to close by giving you what really, to me, a little quote about political involvement. I know a lot of times politics is a dirty word with a lot of folks these days, but I don't have to believe that. And philosopher Raymond Molley once said, "Politics is not something to avoid or abolish or destroy. It is a condition like the atmosphere we breathe. It is something to live with, to influence if we wish, and to control if we can. We must master its ways, or we shall be mastered by those who do."
Well said.
Thank you, Mr. Abate.
Thanks, Joe. You know, I think I support all the things that Joe had mentioned, and so I won't repeat them. I think, and they're all critically important, the engagement and knowing the elected official, getting involved in the campaign of someone seeking political office that you believe in. I think another critically important thing is understand the issues. You're students now. You never stop being a student. You never stop learning. Really try to understand what are the issues affecting me as a person, my family, my neighbors, my community, and what, you know, are there speed bumps by the schools? Do there need to be? What should I do? Do we have a high level of obesity, tobacco use? Is there a helmet law in place? What are the issues facing the community that I'm living in and involved in, and how do I get involved? Find a not-for-profit organization whose values you believe in, whether it be Special Olympics, whether it be Boys and Girls Club, some group, some entity, some organization that has the values and beliefs and is supporting things that you believe in your heart, that you can get behind and support, either financially or as a volunteer, and help them in their process to influence some of the elected officials and policies in the communities. You know, like they say, it is local. It really truly is. Get engaged. Get involved even in the homeowners association that you live in. I've been president of my homeowners association. It's the most thankless job I've ever had. You know what I mean? For
Except for being on the school board.
Expect for being on the school board. There you go. Homeowner, but you do it. You do it because you want to make a difference and you want to make things better. And sometimes we do that. So try to identify and understand the issues in your community and see what you can do to help address them. The more educated you are about them, the better the decisions you can make, because you got the values already. You're here because you've got those values. You're here because you've got that passion. Now the idea is to take it and convert it and direct it in a way that is going to affect those that are beyond your reach, those underserved and those in the communities that you serve. Thanks a lot.
Thank you, Chief Dillenberg. Ms. Chen?
I really echo what has just been said about getting involved and being educated. I remember my first year of medical school, like I didn't really know much about like the healthcare situation at hand, so I remember like sitting at home watching YouTube videos on like what a HMO versus a PPO, and like watching videos on like what the benefits and the disadvantages of a single payer health system. And you know, it's like through educating myself through that I was able to have productive conversations with people who were involved with those issues and getting connected through them that way. I also really want to echo like what was said about being members of organizations that you believe in. You know, like we can do so much by ourselves, but think of how much more you can do as a collective group, with a collective group of people who have similar values and goals and passions. And you know, if I've learned anything from my experiences like in Ghana, it's that there's always some person at the end making the rule or making the policy. And right now, we can be those people. You know, if you're sitting here right now, I think that demonstrates an interest and a commitment to serving our communities, in whatever which way. And so, you know, don't underestimate the value of yourself and how much impact you can potentially have. I think it's really important just to get started, just as you right now, like being educated about the issues, and you know, as you get involved, doors will open, opportunities will come, and you'll find, you know, your place in how you can have an impact in the community. Thank you.
Thank you, Ms. Chen. Senator Ward?
All right, last but not least, but so these guys have really already taken most of the good things. You know, get involved, obviously, get to know the people who are supposed to be your voice in your local government, at your school board level, at the state legislature level, your city council members. They make a big difference in terms of your practice in your office and your practice in your hospital, because there are zoning and there are different things that you can actually have an impact on providing care to people. So get involved, get to know the people that are supposed to be working for you, because we do work for you, and so know us. Get involved with your professional organizations. That's a great place to start in terms of hearing about what the issues actually are that are coming up politically. Don't get sidetracked into only knowing one side of what you're passionate about. Get to know both sides so that you know the arguments that somebody's going to be using against you, and also so that your mind is open, because your way of thinking isn't always the right way, isn't always the only way that something can be accomplished. So being able to reach out to people who might not agree with you politically, to come up with a solution that's good for the people that you're both working to help, is invaluable. It's an invaluable skill. So having that negotiation ability with other people. Becoming an important and valued member of your community. So many doctors, I mean, I have people that come to me all the time and say, I don't like doctors, and sometimes I have to say, I don't like doctors either, because some of the doctors that we know think of themselves as up here. Remember that we're all on the same level, we're all people, and if you can become a valuable member of your community, whether it's through joint community service, whether it's through coaching a soccer team, even if you don't have a kid, whether it's going to school board meetings and letting them know why certain things are important to you, that they're taught or not taught, that's a great way to get involved and not really be political, but be valuable to the place where you live. So I always say, just remember you're a real person. Remember you're not a god. Remember that the people who are coming to you are generally coming not because they love to go to the doctor or the dentist or the physician's assistant. They're coming because they have a need. So you need to always keep that in mind when you're frustrated by the paperwork or by the bureaucracy or by the rules or by the computer that you're sitting at. remember that always to focus on that person in front of you. And I try to do that politically as well. Focus on that person in front of me and realize that they have issues and they have dreams and they have goals that I am now in a position that I can help them to accomplish. So, the main take-home message is just get out there, get involved, and don't sit back and wait for things to happen. Don't put your head in the sand and then be surprised when things are different than you'd like them to be. So get involved.
Thank you, Senator Ward. We actually have a little bit of time left for questions if anybody has any.
As the Student Dental Association, we're going to be teaming up with the Arizona Dental Association in a couple weeks to take on Capitol Hill here in Phoenix and talk about the issues. One of the main issues that we're concerned with is with the expansion of Medicaid, reinstalling these dental benefits to the adult population and the special needs population in our community. What's the best way that we can influence the senators and the congressmen and women in Phoenix to fall in line with how we feel about it? Is there an attack plan for us to go through on this?
Well, I'll tell you, just for me, I love to see people coming to my office or meeting me outside at the lunch or wherever it is and telling me about the issues. Being armed with a couple of little facts, a couple of facts, not overwhelming the legislature with facts is important. And then if you can have a story about someone that you know, that something's happened to drive that home emotionally, it really makes a big difference. For me, being a physician down there, I think sometimes the other legislators think I'm making up stories that I tell, and I tell them I can't make this stuff up, and so if you come with a few facts that drive home the point about cost and how to save money for the taxpayer, obviously that makes a big difference, and then drive it home with that emotional story, you can really make a big difference.
I just really want to echo that, as a student who's attended DOJ for the last 3 years in the Arizona Dental Legislature, people just want to hear about you. You can come with you could read off a list of facts, but that's not going to stick with them. What sticks with them are your stories. And so I think don't never undervalue your experiences and what you have to say regarding those experiences.
Having been involved with DOJ for many years at the legislature, and that's coming up in March, I see the student involvement from the medical schools so important that they see 50 white coats coming out there. It's really impressive. And just being there, believe me, it has an impact, just your visibility. You lobby, obviously go talk to your legislator, and that's part of the process. During that day, it's very important. But again, it gets back to the education. They'll listen to you from your experiences and your feelings, and especially you as students, and they're particularly interested, I think. You're a real asset to your profession by being involved and being down there at those days for that legislative day, whether it's dental day, DO day, or whatever. It's really important.
One quick tidbit I'll just share with you. On a national level, this country is going in the direction of what's called the 3 AIMs. And in terms of healthcare, you need to know what they are. The 3 AIMs. 1, to improve the healthcare experience for patients. 2, to improve health. And 3, to reduce costs. That's what they're talking about in Congress. That's what they're talking about at CMS. That's what they're talking about at HHS. I sit on 2 national advisory bodies in health, and the 3 AIMs keeps coming up. I suggest that you look into that and frame your discussions around what will improve the health experience for patients in terms of efficiency, effectiveness, what it may be, what will improve health, and what will reduce cost. You look at those 3, then you've engaged in a conversation that I believe elected officials will be more curious to learn about.
My question is about that. When we have underserved populations, which can be where 30 to 40% of the population, when you try for the triple aim, but you don't have adequate resources, how do you build the awareness necessary to actually address some of the areas that you see?
Well, part of it is education. Access to care is a very tough one. In dentistry, we have it, 48% of people don't show up. Some of it's money, some's transportation, some's ready, willing, able providers. There's another component. It's called interest in getting dental health. And I think part of the issue is educating the public to realize how important healthcare is. I think that is part of it too. When you start to get the public engaged, when they start calling and wanting it, not just us, not just the educated, not just the providers, but the public, when they start wanting and engaging and demanding improved health care, we're going to see some changes. So I think raising that level of health awareness, oral health, dental IQ in our business, or health awareness in the overall health process will help improve access, I believe, and get some of the people coming, because I know in dentistry, there are people with dental insurance, transportation, and a provider that don't show up.
They don't like dentists.
Yes. I have a couple of ex-wives that feel that. No. Joke. But I think it's a matter of, I think, and that's part of it, that education at all different levels.
And I agree, just being engaged and letting people know what the issues are. I was just going to say, we had a little bit of,
humor.
We don't like, you guys don't like social media. I love social media because I think that's the only way to connect with the future generation. Most of you guys aren't going to go to a website to try to track it down. You want it to come to you. And social media allows that two-way conversation between a lot of your elected officials. Some people do have young staffers who are 25 years old that are doing their tweets and doing their communication, but many people are doing it themselves. So if you can engage on social media, you can make your voice heard. Don't be an annoyance on social media, just be an advocate and an expert, and people will seek you out as someone who's got something important to say. And if it's about providing access to underserved care, a lot of people don't even know that that's an issue because they're so worried about who won American Idol or who's on Dancing with the Stars. Getting those real issues out to people in a way they can connect with is very important. And I think you all, as young people, could have a serious impact on the future of health in our country. So do that. And by the way, you can join me on social media, on Facebook and Twitter, Kelly Ward, Arizona, AZ, Kelly with an I, because I care about the people.
All right. Well, this concludes today's panel. On behalf of the Student Osteopathic Medical Association and everyone in attendance today, I'd like to thank our panelists for their responses. I'd also like to thank Dr. Morgan for helping us organize the panel.
Thank you.